Joined by Liberal MP Katie Allen, Federal Liberal Higgins member. But you're not just a politician. In your former life, you were a doctor, you were a professor and a public health researcher, so you're uniquely placed to talk about this unfolding crisis. How do you see the current response? Do we have this disease under control, and are we lowering the curve, which is the aim of the current measures?
Thanks, Rita. Well, I think, having been a medical student and doctor during the HIV/AIDS epidemic, watching that unfold, and then spending a lot of my medical research life trying to flatten the curve for food allergy, what the Prime Minister and the National Cabinet are doing at this point in time is unbelievably good, and they are following the evidence, and that's what we really want to hear as Australians. They're looking very carefully overseas and taking those measures and applying them here in Australia. And I think, full marks to Scott Morrison and the National Cabinet, Greg Hunt and Brendan Murphy for what they are doing. The important thing to remember is we actually developed one of the first cases here in Australia back in January 24th. And so we've had this epidemic for about 6 or 7 weeks. And we've had a very low mortality rate of only 7. I mean, every death is terrible, I would say, but we've actually had a very low mortality rate. And I believe it's because we've been very strong on the way that we've applied layers of border control from the hotspots. So first of all, it started with Wuhan, and then mainland China, then Iran and South Korea, and finally Italy, and now we have them applied to the whole world. Now, they're extraordinary measures. They're taken in a proportionate way, and we've kept our curve of cases and mortality very low. I will say there's been a kick up in the last 24 hours, which of course we're watching very carefully, but that is likely due to the fact that there are more cases coming back from overseas as Australians quite rightly return home.
Well, we've asked all our citizens around the world to return home, and the borders are closed to non-citizens. We were one of the first, and there was certainly criticism. We moved before the WHO guidelines in imposing travel bans, particularly with China. Were you supportive of those at that stage? Because there was criticism because the WHO was saying don't impose travel bans, and Australia, Singapore, US and a few other countries went alone and did that.
I have to say, I remember lying in bed awake one night thinking, goodness, what should we do tomorrow? And the Prime Minister, stepped in. And I thought, thank goodness, here is someone who knows exactly what they're doing. He's formed a national cabinet, includes all the premiers and state territory ministers. He's included all the chief health ministers from around the nation. He has the brains trust of Australia in there, helping and guiding an evidence-based decision-making going forward. And he's been very proportionate about laying these things on. So I think what we're doing is right, because at this point in time, I believe the border controls is being very effective. We now have new ones in place at the moment. Let's see how they have an effect. But we need to make sure that we keep the caseload down, because, of course, that will keep the mortality rates low as well.
Now, you have expertise in the area of children. That's what much of your research was centred on. This virus seems to be gentle on children compared to the rest of the population. Do we know why that is? There are children who are very adversely affected, but certainly it seems not to have as bigger impact on them as many other viruses that are out there.
And that's correct, Rita. So the first thing to say is often the flu virus will have a big impact on what we call the extremes of life age. So the very young and the very old, and that's why we encourage people to get flu at the very old and very young, and those people who have extra conditions, immunocompromised or other conditions. This coronavirus appears to be acting quite differently from that, and we know that those people who are older unfortunately have a much higher mortality risk globally, and we've yet to see that impact in those who are younger. The idea is there's been one recent paper suggesting that smaller children don't have the correct receptor to actually take up the virus, and so there may be a biological reason for that. We don't know. Now, that's just one paper. It's a new finding, and we need to be open-minded. The important thing is, though, is that children don't seem to have as severe a consequence, and the mortality rates are most certainly much lower, particularly in people even under 50, not just children. So we're looking at a mortality rate that is affecting, unfortunately, older citizens.
Well, when we look at the mortality rate, there seems to also be wild differences country to country. You look at South Korea, mortality rate of less than 1%, whilst Italy around 7%, and their official death toll is now surpassed China's official figure, if you can believe China's official figure. What do you think's behind that, and what can we do to replicate the South Korean experience? Is it purely because Italy's got a far older population and the health system can't cope, or are there other factors at play as well?
So the first thing is I monitor the mortality rate, so the death rate, because that's the thing we absolutely can be sure of country by country. It's a very accurate number, and we know that Italy has an extraordinary number of deaths, now exceeded that of China. But its neighbour, Germany, has an extraordinarily low number of deaths despite a high caseload. So the caseload means who's got symptoms and is getting tested. We also know there's probably those who don't have symptoms that are also being tested. So caseload is actually very hard to look at, its mortality rate. And we don't know why Italy's been doing worse than, say, Germany. They're both in very similar geographical places. One theory is that Italy has a higher age rate, and so there's more people who are more at risk. But the other thing is Germany does have a very high number of intensive care beds, and I will say that our healthcare system here in Australia is working very quickly to prepare for what's coming. If it is coming, we hope it doesn't come. And as we've learnt from previous epidemics, Australia is very good at looking to the rest of the world and learning quickly.